Yuha! Hello, we are Illness Anxiety Disorder by Kevin Lee and Evie Park.
So what is IAD? So it's a condition in which a person is preoccupied with developing a serious medical illness.
And the symptoms of illness anxiety disorder is excessive worry over having or getting a serious illness. And it also includes physical symptoms that are not present, or if present, they're only mild, and high level of anxiety and alarm over personal health status.
The criteria for DSM-5 states the individual is preoccupied with having or acquiring a serious illness. Somatic symptoms are not present, or if present, are only mild in intensity. If another medical condition is present, or there is a high risk for developing a medical condition, the preoccupation is clearly excessive or disproportionate. The individual has been preoccupied with illness for at least 6 months to be diagnosed with illness anxiety disorder.
So what factors may cause someone to be diagnosed with illness anxiety disorder? A person may be influenced to have illness anxiety disorder when they interact more with medical environments. Illness anxiety disorder does not happen because they have problems with their mental health. It is rather with their interactions and environment around them. Having relationship or family problems may also cause excessive worry, which can frustrate the patients. And overall, people diagnosed with illness anxiety disorder tends to go to hospital all the time or none at all.
An example of illness anxiety disorder is a person who coughs lightly will diagnose themselves with lung cancer, but when actually it will just be a cold. Famous person with IAD is Charles Darwin, Abigail Breslin, and Adolf Hitler. These three people were diagnosed with illness anxiety disorder for making themselves feel ill all the time with serious illness.
The hoarding disorder, to put in simple words, is you keep your stuff and you cannot get rid of it, so you keep it. Now, this disorder is not just about keeping several items, but you excessively keep these items that are useless even if there's not enough space at your house, such as keeping old food or trash, or even furniture. Now, reason why you have this disorder is because you believe that the items will have use in the future or later on. And you also believe that these items have emotional significance, such as it reminds you of good old days, or you just feel safe around these items.
This is how the DSM-5 categorizes the hoarding disorder.
Now, what makes this hoarding disorder be in the category of OCD? Now, OCD, as you know, is an obsessive compulsion disorder. Now, in this disorder, because you're obsessed with items to an excessive level, you have this compulsion of having difficulty getting rid of these items. So this is why the hoarding disorder is in the category of OCD.
There are many factors that contribute to this disorder. First, there are genetical and biological contributions. If you're related to a person who's diagnosed, then you have a higher chance to be diagnosed as well. Environmental factors such as traumatic life events can also lead to hoarding. They might keep things just in case similar life events reoccur. Also, social factors such as social isolation leads to collecting things to relieve stress or to feel support. A famous person with this disorder is Grey Gardens. The story of Grey Gardens demonstrates how hoarding can affect people from all levels of society. She had a collection of food containers, boxes, and lids, which are considered trash, but to her, those were considered attractive. She was eager to fill the empty space with containers. Clearing out was hard for her because she feared that she would lose her life when she lost everything. These few clips will help summarize hoarding.
They keep everything.
I've been acquiring things as long as I can remember.
It was out of control.
This I want to keep that.
And risk losing so much more.
My husband moved out.
I am threatened with eviction.
I'm scared that he's going to completely break down.
It's like leading a double life.
This room is my dining room. Right now it is used as a place for my computer, for my clothes, my medicine. I spend a lot of time on the computer when I'm not doing other things. The dogs are enjoying laying on all my clothes because they have mommy scent. You can't believe it, but there is actually a great dining room table underneath here. I have one usable chair that I know of. There might be some more around the table. I really don't remember, but became a dumping ground for clothes, pop bottles, junk. And buried underneath are containers. There's new stuff. I found a brand new pair of boots. Only one boot though. Doesn't help me. And if it didn't fit in this room, I put it in my spare bedroom. This is my kitchen. A sink that has trash all over it. I can't really get to it without moving all of that away. Cabinets that have food in it that starts from 1998 and the cans are black. This can, it had an expiration date of December 2001.
Criterias. Main criterias. This is what you should focus while you're solving questions. First, A, an inability to recall important autobiographical information, usually of a traumatic or stressful nature that is inconsistent with ordinary forgetting. Note that dissociative amnesia most often consists with localized or selective amnesia for a specific event, or generalized amnesia for identity and life history. Criteria A is most important criteria among all criteria, so please note this. B is the symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Some other criteria includes the disturbance is not attributed to the physiological effects of a substance or neurological or other medical conditions. This means there is no drugs, no medication, no beer, like nothing at all. D. The disturbance is not better explained by dissociative identity disorder, post-traumatic stress disorder, acute stress disorder, somatic symptom disorder, or major or mild neurocognitive disorder.
Now I am going to talk about dissociative fugue, which is a subtype of dissociative amnesia. Dissociative fugue state is a condition in which a person may be physically and mentally escaping an environment that is threatening. It also engages in unexpected travel, and people experiencing a fugue state may also develop a new identity. Dissociative fugue is a rare condition, with prevalence estimates as low as 0.2% in the general population. Fugue states are more commonly seen in adults than in children. Symptoms: sudden and unplanned travel, inability to recall past events, confusion about his or her identity, and it is very hard to distinguish fugue from sleepwalking. The travel that may occur in a dissociative fugue state can last for as little as a few hours or as long as weeks or months. Causes are: it is often the result of trauma and is most commonly associated with childhood victims of sexual abuse who learn over time to dissociate memory from the abuse. And when people recover from fugues, they typically feel shame, guilt, and embarrassment. Hannah is an example case of dissociative fugue, and in September of 2008, Hannah went missing for 20 days in New York City. When she was pulled out of the river, she had no memory of where she had been. The last thing that she remembered was going for a run along Riverside Drive in Manhattan. When her family and friends discovered she was missing, they found her passport, wallet, Metro card, and ID in her apartment. It didn't make any sense why she would disappear. And 20 days after her disappearance, the captain of the Staten Island ferry spotted what they assumed was a dead body floating face down in the water. 2 people boarded a skiff to fish the body out. When they did, she gasped for air and began to cry. She had no idea of how she got there or how much time had passed out. But she remembered who she was, but she couldn't remember how she managed to survive alone.
Factors. So the 2 factors that could influence or cause dissociative amnesia is environmental and genetic and physiological. Environmental, single or repeated traumatic experience are common antecedents. Dissociative amnesia is more likely to occur with a greater number of adverse childhood experience, particularly physical and or sexual abuse. Second, interpersonal violence. And third, increase the severity, frequency, and violence of the trauma. For genetic and physiological part, there are no genetic studies of dissociative amnesia. Studies of dissociation report significant genetic and environmental factors in both clinical and non-clinical samples. Prevalence. The 12-month prevalence for dissociative amnesia among adults in a small U.S. community study was 1.8%, 1% for males, 2.6% for females.
I'll be looking into a personality disorder called paranormal personality disorder, or as some people call it, paranoid. This definition from psychologytoday.com says the paranoid personality disordered person is suspicious of others. This individual thinks that others are out to threaten, betray, exploit, or harm other people. This is the paranoid personality disorder criteria. And what it basically says that is people who are diagnosed with paranoid personality disorder are very untrustworthy, and sometimes just like most people who are categorized as paranoids are imagining things or seeing things or talking with things that most of us don't see. Sometimes they will randomly attack person just because they think they see something and we don't really see it. And they are very aggressive and have a very aggressive mood swing, and they are very unforgiving. The causes of paranoid personality disorder is unknown. However, researchers believe a combination of biological and environmental factors can lead to disorders, such as this disorder being more present in families with history of schizophrenia or delusional disorders. And also, early childhood trauma may be a contributing factor. The traits that correspond to people who have this disorder is that they always suspect someone who will harm him, her, or it, and they are always suspicious. They see attacks on him other people don't see and counteracts to whatever he or she or it sees. They don't forgive people easily. They read simple gestures as threatening or demeaning, and they don't confirm information about him, her, or it, so he, she, or it does not get used against them. This is basically what the diagnostic criteria lists. The symptoms are that they think that people are always against them. They are confrontational and aggressive. They are very violent. They doubt a lot of friends, and they only have some very close friends. They don't have much. They always want to confront friends about something, and they even have a tendency to overthink small things, events, and things that would turn into something bad. They also bear grudges, and again, they get angry very easily. So this is a main point. The prevalence of this disorder is that it occurs in 0.5% to 2.5% of the population. 2% to 10% occurs within psychiatric outpatients, and this thing, in the gender perspective, is more common in men. 6.5% of adult population is diagnosed with this personality disorder, and paranoid PPD, also known as paranoid personality disorder, takes 1.2% of the population, and paranoid personality disorder was the second most prevalent, with 4.4 behind the obsessive compulsory disorder, which we will see in the next slide. This is the statistics, and as we see, 7.9% occur in the are responsible for obsessive compulsive personality disorder, and 4.4% comes from the paranoid personality disorder, and the lowest is dependent personality disorder. The treatment for this, it is hard to treat because of reduced levels of trust. People get very angry easily, and they have a very strong sense of untrustness. But then the most recommended treatments are psychotherapy, which is personal counseling with a therapist and talking through their hard feelings and what they're going through. Antidepressants are also used within psychiatric medication, which is used to aid mood disorders, as these people with this disorder are very aggressive, and as I said again, they don't like to trust a lot of people, and they are very violent when they see something that other people don't. Another thing is antipsychotics, which is a medication used to manage psychosis. And lastly, it's anxiolytic, which is a drug used to treat symptoms of anxiety. This is a famous person, and although it's not 100% confirmed, most sources that I have found seem to claim that Joseph Stalin was diagnosed with this disease. This is a video of someone who was diagnosed with this disease. This is an example, and there will be two people, and one man is standing on this construction site, and the other man is questioning about the construction site, and the man who is questioning about the construction site has paranoid personality disorder. These are my citations, and the video we see here. We can see that there is a sense of mistrust. We can see that he's starting to get aggressive. He doesn't believe anything about what the person says. We can see that he's starting to become violent, aggressive, showing violent mood swings. we saw three of some of the diagnosis criteria that we saw in the DSM-5, and through that we can see that this person can be diagnosed and is diagnosed with paranoid personality disorder.
Antisocial personality disorder is a personality disorder that is characterized by a pattern of disregard for and violence of the rights of others. The diagnosis is not given to individuals under the age of 18. To get diagnosis, the person should conduct a symptom since the age of 15. Antisocial personality disorder is much more common in males than in females.
For the diagnostic criteria, you need to have 2 or more in these 4 areas. 1. Identity. 2. Self-direction. 3. Empathy. And 4. Intimacy. Empathy is the lack of concern for feelings, need, or suffering of others. Intimacy is the incapacity to have intimate relationships. One also needs 6 or more in these 7 pathological personality traits. 1. Manipulativeness. 2. Callousness. 3. Deceitfulness. 4. Hostility. 5. Risk-taking. 6. Impulsivity. And 7. Irresponsibility. Hostility is the persistent or frequent angry feelings. Impulsivity is acting on the spur of moment in response to immediate stimuli.
There's 2 factors that can lead to antisocial personality disorder. First one is environmental factors. Unstable, violent, or chaotic family life during the childhood. Second one is biological factors. Family history of antisocial personality disorder and brain activity, which shows low arousal level. Antisocial personality disorder is difficult to treat, but for some people, treatment for over long term may be beneficial. Treatment depends on each person's particular situation, their willingness to participate in treatment, and the severity of symptoms. Drug treatment and talk therapy may be helpful in treating antisocial personality disorder.
There is a famous American serial killer named Ted Bundy who kidnapped, sexually assaulted, and murdered 30 or more victims. He was widely known for his charming looks and personality. In the next video, we will show a video about Ted Bundy.
He didn't look like anybody's notion of somebody who would tear apart young girls. My name is Ted Bundy.
A person of this type chooses his victim for a reason. Possession, control, violence.
Something unique about Ted's brain. He talked in terms of a voice in his head, and this voice would start saying things about women.
He had very blue eyes. When he really got going, his eyes went absolutely black.
Murder, leaving a person of this type hungry, unfulfilled, would also leave him with the obviously irrational belief that the next time he did it, he would be fulfilled. And the next time he did it, he would be fulfilled. Or the next time he did it, he would be fulfilled.
Let me tell you something. There is no nobility in poverty. I have been a rich man and I have been a poor man, and I choose rich every time. Because at least as a rich man, when I have to face my problems, I show up in the back of a limo wearing a $2,000 suit and a $40,000 fucking watch.
This is a great example of one of the personality disorders, narcissistic personality disorder. But what is a narcissistic personality disorder? In one sentence, it is a pervasive pattern of grandiosity, need for admiration, and lack of empathy.
Out of the 9 criteria of narcissistic personality disorder, these 3 are the most unique and important. One should have a grandiose sense of self-importance and a sense of entitlement, and should lack empathy.
There are many symptoms regarding a narcissistic personality disorder. However, the major symptoms of this disease are having excessive self-importance, fantasies of unlimited success, power, intelligence, and love. People diagnosed with narcissistic personality disorder have excessive admiration, sense of entitlement, lacks in empathy, they disregard what others feel, and believe that they should only be interacting with the people in the same class as them, such as special or high-status people. There are many other disorders that are present in patients diagnosed with the narcissistic personality disorder. People with the narcissistic personality disorder may also be diagnosed with disorders such as mental health disorders, personality disorders such as histrionic, borderline, and paranoid personality disorder. The patients may also be having abusive behaviors. Because of the similar symptoms of a narcissistic personality disorder and a borderline personality disorder, many are misdiagnosed as borderline personality disorder.
For prevalence, 2 to 16% of the clinical population is diagnosed with narcissistic personality disorder, which is approximately 0.5 to 1% of the general population. Narcissistic personality disorder has been more prevalent in male patients. Around 50% to 75% of the whole population is diagnosed with the disorder.
The two most commonly used treatments for narcissistic personality disorder are verbal psychotherapy and cognitive behavior therapy. Cognitive behavioral therapy is where the patients are given tasks for more effective coping skills which the patients could ultimately use to cope with their disorders.
The two major factors that interact with narcissistic personality disorder are environmental and cognitive. For environmental factors, the patients diagnosed with narcissistic personality disorder may have had parents with insensitive parenting styles, and they also may have been environments where they had extremely high expectation and excessive criticism. For the cognitive aspect, one of the most common examples is trauma. A patient may have a trauma that eventually led to the diagnosis of narcissistic personality disorder. Despite the absence of actual diagnosis of narcissistic personality disorder, Kanye West easily depicts some of the symptoms of narcissistic personality disorder because of his overly self-loving characteristic that he definitely shows in the public. For instance, when there was an acceptance speech for a music award given to Taylor Swift, Kanye West proclaimed that another artist should have been the winner, both humiliating Swift publicly and making himself the center of attention. Everyone wants to look good in front of others, so it is very difficult to diagnose narcissistic personality disorder and also to find an actual accurate treatment. Hopefully in the future, there will be easier way and more accurate way to diagnose narcissistic personality disorder and hopefully to find an actual cure for the disorder.
Histrionic personality disorder. When you first hear histrionic, you probably won't think of anything because you might not know what it means. So let's first start by defining histrionic. Histrionic means overly theatrical or melodramatic in character or style. So if we get into a personality disorder, it will mean that the patient needs to be in the center of attention and they show seductive or provocative behavior in order to gain that attention. So this is the diagnostic criteria from DSM-5, and according to DSM-5, the symptoms have to begin by early adulthood, and they have to be present in a variety of contexts. So they don't just happen in one place and not in the other. They have to occur in various situations, and 5 or more of the following symptoms have to be present in the patient in order for the patient to be diagnosed as histrionic personality disorder. And we will also discuss in the next slides, the difference between histrionic personality disorder and other cluster B personality disorders, such as borderline personality disorder and narcissistic personality disorder. And of the following 8 symptoms, we decided that it would be important to emphasize 1, 5, and 6, which is that the patient is uncomfortable in situations in which he or she is not the center of attention, and the patient also has a style of speech that is excessively impressionistic and lacking in detail. And lastly, the patient shows self-dramatization, theatricality, and exaggerated expression of emotion. The features of this disorder is that the patient does anything for attention, just in abnormal ways, and the patient has excessive emotionality and attention seeking in various contexts, so they overreact to other people, which causes them to be often perceived as self-centered, and they have excessive sensitivity to criticism or disapproval, and therefore they have low tolerance for frustration or delayed gratification, and they blame personal failures on others. And most importantly, they sabotage their relationship in order to gain attention. So basically, in 2 words, this personality disorder is attention addiction. So the previous features lead to the patients having difficulty achieving emotional intimacy in romantic or sexual relationships, and they often act out of role in their relationship.
Hey Lynn, look what I brought for you. This is a present from France. Yeah, I went to France for like a week and I brought like a bag and those necklaces for you, and it was really nice that trip.
Why did you go to France? Just go for like shopping?
Yeah, of course you're shopping, and I did some like awesome things right there.
Hey Bono, can we talk for a second?
Sure.
Oh, do you know what's today's lunch?
No, I don't know what's today's lunch for you. Hey, where you going? Where you going, huh? You have to talk to me. Why do him?
So the key factors are culture and genetics. And in culture-wise, the histrionic personality disorder occurs more frequently in women than in men, mostly because attention-seeking and sexual forwardness are less socially acceptable for women than for men. And genetics-wise, the twins study shows that identical twins show 3 or 4 times higher concordance rate of HPD occurrence than in fraternal twins. And in psychoanalysis views, fixation in one of the psychosexual stages also causes histrionic personality disorder. And also, bad family relationships, such as the child's temperament and parenting style not matching with each other, is also responsible for causing histrionic personality disorder.
Here's some examples of famous figures who are assumed to be diagnosed with histrionic personality disorder. The list includes Megan Fox, Kim Kardashian, and Kanye West. Megan Fox is assumed to have both histrionic personality disorder and borderline personality disorder. Talking about these two, it is often confusing to distinguish between cluster B disorders. For example, although borderline disorder can be characterized by attention-seeking, manipulative behavior, and rapidly shifting emotions, it is distinguished by self-destructiveness, angry disruptions in close relationships, and chronic feelings of deep emptiness and identity disturbance. Another example is narcissistic personality disorder. Although individuals with narcissistic personality disorder crave attention from others, they usually want praise for their superiority, whereas individuals with histrionic personality disorder are willing to be viewed as fragile or dependent if this is instrumental in getting attention. Individuals with narcissistic personality disorder may exaggerate the intimacy of their relationships with other people, but they're more apt to emphasize the VIP status or wealth of their friends.
As one of the well-known disorders, ADHD, attention deficit hyperactive disorder, is pretty much self-explanatory with its name. An individual diagnosed with this disorder is, like its name, extremely lacks attention and is hyped up in every second of their life. According to the DSM-5 definition, ADHD is a mental health disorder that causes above normal levels of hyperactive and impulsive behaviors. In order for the person to be diagnosed, they have to show at least 6 symptoms from the DSM for at least 6 months persistently. This is the criteria according to the DSM, which is a lot. But the most important symptoms for inattention is having difficulty in maintaining and giving attention to everyday activities or interactions with others, like paying attention to what your friend was talking about, or when asked to write a paragraph about your favorite food, the individual would end up talking about books. The second is being very forgetful. An individual diagnosed with ADHD would have trouble having a conversation with a friend or end up not remembering certain actions that he or she did. Lastly, people diagnosed with ADHD tends to avoid activities that require brain work, like school essays on Macbeth plays. Most important symptoms for hyperactivity and impulsiveness are, first, they talk excessively. Secondly, people diagnosed with ADHD can't stop themselves from fidgeting in their seats when they are asked to sit down for a long time. Lastly, they have trouble waiting. A person going through this disorder wouldn't help but act out before they think.
ADHD is largely caused by biological factors. ADHD is a largely genetic disorder. Specifically, neurological imbalances are present in people who are diagnosed as ADHD. However, the exact cause is unclear. Research shows that parents and siblings of a child with ADHD are more likely to have ADHD themselves. It is related to smoking during pregnancy, and this reflects common genetic risk. This is correlated, but not the causation. This disorder is more frequent in males than in females in the general population, with the ratio of 2:1 and 1.6:1 in adults. Plus, boys with ADHD are more likely to actually act out the symptoms than the girls.
Some famous examples of people who are diagnosed with ADHD are Van Gogh, Abraham Lincoln, Michael Jordan, and Jim Carrey. These successful examples of people who are diagnosed with disorders but still manage to go through them successfully show that the stigma of the misinterpretations of people who are having ADHD, that they are stupid and unable to succeed, are invalid.
Now, one last question for you guys to think with us. Why would someone want their child to be diagnosed as ADHD?
The answer is drugs. The drugs that are prescribed for ADHD help sharpen your cognition, which could help the child's grade by raising their rate of concentration during class and when taking tests. Furthermore, the child would be distressed with their condition, which would mean that they would obviously want help.
Hello everyone, we are Richard and Tyler. Today we will be talking about autism spectrum disorder. Before we start, what is autism spectrum disorder, or ASD for short? ASD refers to a broad range of conditions characterized by challenges with social skills and communication. It is classified as a developmental disorder because its symptoms tend to appear in the first 2 years of life. There isn't one specific type of autism. It is called autism spectrum disorder for a reason. Each individual diagnosed with ASD shows symptoms with varying degrees of severity. Furthermore, the Public Health Agency of Canada has conducted a survey on Canadian youths between the ages of 5 and 17 years. They found out that 1 in 66 youths have ASD. Also, they found that males are more likely to develop ASD, as 1 in 42 males were diagnosed with ASD, whereas only 1 in 165 females were diagnosed with ASD in 2015. According to the DSM-5, people diagnosed with autism spectrum disorder exhibit 3 main diagnostic behaviors. First, they have a lack of communication skills. For example, they show abnormalities in eye contact and body language, and difficulty understanding and using gestures. Second, they have restricted and repetitive behaviors, such as fixated interests that are abnormal and are stereotyped, or they have repetitive motor movements. Third, they have symptoms that show a lack of social skills. Among those symptoms are abnormal social approaches and the failure of normal back and forth conversation, and failure to initiate or respond to social interactions. There are two major factors that cause ASD. The first one is genetics. Several different genes appear to be involved in autism spectrum disorder, but there isn't one specific gene that causes ASD. For some children, autism spectrum disorder can be associated with a genetic disorder such as Rett syndrome or Fragile X syndrome. For other children, genetic changes or mutations may increase the risk of developing autism spectrum disorder. And then there are environmental factors. These are not confirmed, but researchers are currently exploring whether factors such as viral infections, medications, or complications during pregnancy, or air pollutants play a role in triggering autism spectrum disorder.
Some of us may be familiar with The Good Doctor, a TV drama. In the US version of the show, its main character, Sean Murphy, is a doctor who has Savant syndrome, a variation of autism. Those diagnosed with Savant syndrome have extraordinary abilities in certain areas, such as memory. As autism is often associated with having decreased mental abilities, cases of Savant syndrome may surprise people and provide a different perspective of how we view autism. These videos show two different types of ASD. The first video is an example of an extreme case of autism. In the video, the man repeatedly punches himself and shows other abnormal behaviors such as crashing into the wall. He also has difficulties in social interaction with his mother. The second video is about a man with Savant syndrome, a form of autism where one has extraordinary high abilities in certain areas, which would be memory in this case. As seen in the video, the man is able to draw the entire New York City skyline in detail just after observing it for a short period of time. To end up, it is important to know that some people with autism may not be able to speak or answer to their name, but they can still hear your words and feel your kindness. Although people diagnosed with autism may be different from us, that doesn't mean we should treat them differently. It is not good to stigmatize certain people just because of a mental disorder or illness.